Your morning pills might be stealing your memories. Right now, millions of seniors are taking medications their doctors prescribe to help them. But recent scientific studies have uncovered a terrifying connection between some of the most commonly prescribed drugs and rapid cognitive decline. We're not talking about rare medications here. These are pills sitting in medicine cabinets across America, trusted by patients and doctors alike. Yet research published in major medical journals shows they could be accelerating dementia at an alarming rate. One class of medications increased dementia risk by a staggering 54% in patients who use them for just 3 years. Another study followed over 3,000 seniors for 7 years and found certain drugs caused measurable brain shrinkage on MRE scans. The most shocking part, the number one medication on our list is prescribed to over 15 million Americans every single year. And a groundbreaking study published in JAMA Internal Medicine found it dramatically increases dementia risk within months of starting treatment. The scientists couldn't believe what they were seeing in the data. You can find all research and medical studies in the description below if you'd like to dive deeper after watching. Before we begin, tell us in the comments now your age and where you're watching us from. We're reading and replying to every single comment. So, drop your comments below. Now, without any further ado, let's get started. Number 9, antihistamines for allergies and sleep. Let's start with medications many people don't even consider dangerous because they're available over the counter. First-generation antihistamines like diphenhydramine and chlorpheniramine are found in popular allergy medicines and sleep aids that millions of seniors use regularly. These drugs work by blocking histamine receptors in your body, which stops allergic reactions and makes you drowsy. But they also block something called acetylcholine in your brain. Acetylcholine is a neurotransmitter that's absolutely critical for memory formation and learning. When you block it repeatedly over months and years, you're essentially preventing your brain from doing one of its most important jobs. A study published in JAMA Internal Medicine followed 3,434 participants aged 65 and older for over 7 years. The researchers found that people taking these antihistamines had significantly lower brain volumes on MR scans compared to those who didn't take them. The hippocampus, which is the memory center of your brain, showed the most dramatic shrinkage. Even more concerning, participants taking these medications scored worse on cognitive tests, measuring memory, problem-solving, and planning abilities. The study calculated that taking these drugs regularly was equivalent to aging your brain by an extra 2 to 3 years. Many seniors take these medications every single night for sleep without realizing they're trading temporary rest for long-term cognitive health. The effects are dose-dependent too, meaning the more you take and the longer you take it, the worse the impact becomes on your brain function. Now let's talk about medications for an incredibly common digestive problem. Number 8, proton pump inhibitors for acid reflux. Proton pump inhibitors, or PPIs, are among the most prescribed medications in the world for treating heartburn and acid reflux. Brand names like omeprazole, lancapriol, and isomearazole are household names, and millions of seniors take them daily, often for years at a time. These drugs work by shutting down the pumps in your stomach that produce acid, which provides relief from that burning sensation. But research has uncovered a disturbing link between long-term PP use and dementia. A German study published in JAMAology analyzed health records of 73,679 participants aged 75 and older who didn't have dementia at the start. The researchers tracked them for 7 years and found that those who regularly used PPIs had a 44% increased risk of developing dementia compared to those who didn't use these medications. The mechanism behind this is fascinating and frightening. When you reduce stomach acid for extended periods, you impair your body's ability to absorb vitamin B12, which is essential for maintaining the protective coating around nerve cells in your brain. Without adequate B12, these nerve cells deteriorate, leading to cognitive decline. PPIs also affect how your body processes a protein called amyloid, and when amyloid isn't cleared properly from the brain, it forms the plaques that are the hallmark of Alzheimer's disease. Another study from the University of California, San Diego found that mice given PPIs showed significantly higher levels of amyloid plaques in their brains after just 3 months. The researchers measured a 30% increase in brain amyloid levels compared to mice not given the drugs. Let's move on to medications that help millions of seniors with bladder control. Number 7, anti-cholinergic drugs for overactive bladder. Overactive bladder affects nearly 30% of seniors, and the go-to medications are anti-cholinergics like oxybutynin, TLT-L-terdane, and solanocin. These drugs work by blocking alkaline receptors in the bladder muscle, which reduces the urgent need to urinate. But as we discussed earlier, blocking alkaline in your body means you're also blocking it in your brain, where it's crucial for memory and cognition. A landmark study from the University of Washington followed 3,534 seniors for more than a decade and tracked every anticholinergic medication they took. The results were published in J Internal Medicine, and they were shocking. Participants who took these bladder control medications for more than 3 years had a 54% higher risk of developing dementia compared to those who never took them. The study used something called the Anticholinergic Cognitive Burden Scale to measure the cumulative exposure, and they found that taking just one strong anticholinergic medication daily for 3 years was enough to significantly increase dementia risk. Brain imaging studies showed actual physical changes too. Seniors taking these medications had measurable shrinkage in their brain gray matter, particularly in regions responsible for memory and executive function. The scary part is that many doctors prescribe these medications for long-term use without discussing the cognitive risks with their patients. Research from the University of East Anglia found that the damage might not be entirely reversible either. Even after stopping these medications, some cognitive deficits persisted in study participants. Next up is a class of drugs that many seniors depend on for anxiety and sleep. Number 6, benzodiazepines for anxiety and insomnia. Benzodiazepines like leorazepam, doipam, and alprazolam are prescribed to millions of seniors for anxiety, insomnia, and muscle tension. These medications work by enhancing the effect of a neurotransmitter called GABA in your brain, which produces a calming effect, but long-term use has been linked to serious cognitive decline. A French study published in the British Medical Journal followed 1,196 participants aged 78 and older for 15 years. None of them had dementia when the study began. The researchers found that those who had taken benzoins for more than 3 months had a 51% increased risk of developing dementia. The risk was even higher for those who took long-acting benzodia, which stay in your system longer. A Canadian study analyzing health data from 1,796 Alzheimer's patients and matching them with nearly 7,200 controls found similar results. People who used benzodiazepines for 3 to 6 months had a 32% increased dementia risk, and those who used them for more than 6 months had an 84% increased risk. The mechanism involves how these drugs affect neuroplasticity, which is your brain's ability to form new connections and adapt. Benzodiazepines essentially slow down this process, and over time, this leads to cognitive impairment. They also affect the structure of neurons themselves. Studies using electron microscopy have shown that chronic benzodiazepine use leads to changes in the shape and function of dendritic spines, which are the tiny protrusions on nerve cells where signals are received. Let's discuss medications that millions take for depression. Number 5, tricyclic antidepressants. Before newer antidepressants came along, tricyclic antidepressants like amitriptyline, noriptyline, and dosapine were the standard treatment for depression, and many seniors still take them today, sometimes for depression, but often for chronic pain or nerve pain. These medications have strong anticholinergic properties, which means they block acetylcholine. Just like the bladder medications we discussed earlier, a study published in the journal Neurology examined cognitive function in 688 participants with an average age of 74. The researchers used cognitive tests and brain imaging over a 10-year period. They found that seniors taking tricyclic antidepressants showed accelerated cognitive decline compared to those taking newer antidepressants with fewer anticholinergic effects. Specifically, participants on Tririclic scored an average of 4.5 points lower on the mini mental state examination after 10 years compared to those on selective serotonin reuptake inhibitors. Brain scans revealed something even more concerning. Seniors taking tricyclic had significantly smaller brain volumes with the most pronounced shrinkage in the temporal lobe, which is critical for memory formation. The study measured an average volume reduction of 8.3% in this region compared to those not taking anticholinergic medications. Another research project from the University of Indiana School of Medicine used PET scans to measure brain metabolism in seniors taking these medications. They found reduced glucose metabolism in the brain, which is a sign that brain cells aren't functioning properly. This reduction in metabolism was most severe in areas of the brain that are affected earliest in Alzheimer's disease. Now we're getting to medications that affect your heart rhythm and blood pressure. Number 4, certain blood pressure medications. Not all blood pressure medications affect cognition the same way, but specific types have been linked to dementia in recent studies. Beta blockers that cross into the brain, particularly propranolol and carvedal, have raised concerns among researchers. These medications work by blocking adrenaline receptors, which slows your heart rate and lowers blood pressure. But when they cross the blood-brain barrier, they can affect cognition. A study from the University of California, Irvine, analyzed data from 774 seniors in a long-term aging study. Participants taking centrally acting beta blockers, which are the ones that cross into the brain, showed greater cognitive decline over 3 years compared to those taking beta blockers that don't cross the blood-brain barrier. The researchers measured cognitive function using detailed neuropsychological tests and found that centrally acting beta blockers were associated with an average decline of 3.2 points on cognitive screening tests over the study period. This might not sound like much, but in the context of dementia progression, it represents a significant acceleration. What's particularly interesting is that not all blood pressure medications have this effect. In fact, some classes of blood pressure drugs called AC inhibitors and angiotensin receptor blockers have actually been shown to reduce dementia risk in some studies. A Johns Hopkins study of over 3,000 seniors found that those taking AC inhibitors had 35% less cognitive decline over the study period compared to those taking other blood pressure medications. This suggests that the type of blood pressure medication matters tremendously for brain health. Let's talk about medications prescribed after surgery and for chronic pain. Number 3, opioid pain medications. Opioid pain medications like oxycodone, hydrocodone, and morphine are prescribed to millions of seniors for pain management after surgery or for chronic pain conditions. These powerful drugs work by binding to opioid receptors in your brain and spinal cord, blocking pain signals. But emerging research shows they have serious effects on cognitive function. A study published in JAMA Internal Medicine followed 2,000 seniors for 12 years and found that those who used opioids regularly had a 60% higher risk of developing dementia compared to those who never used them. The risk increased with both the dose and the duration of use. Seniors taking high doses of opioids for more than 6 months had the highest risk. Brain imaging studies have revealed how opioids damage cognitive function. Researchers at the University of California, San Francisco used functional MRI scans to examine the brains of long-term opioid users. They found reduced gray matter volume in the frontal cortex and temporal regions, which are areas critical for decision-making, memory, and emotional regulation. The reduction was measurable after just 6 months of regular opioid use. Another mechanism involves how opioids affect the production of new neurons in the hippocampus. Studies in animal models showed that chronic opioid exposure reduced neurogenesis by up to 50%. This means the brain was producing half as many new nerve cells as it should, which is devastating for learning and memory. The inflammatory effects of opioids on the brain have also been documented. Research shows that long-term opioid use triggers activation of immune cells in the brain called microglia, which then release inflammatory chemicals that damage neurons. We're now at the second most important medication on our list. Number 2, anticholinergic antipsychotics. Antipsychotic medications like quetiapine, olanzapine, and risperidone are sometimes prescribed to seniors not just for psychiatric conditions, but also for behavioral symptoms in people who already have dementia. And this practice is particularly concerning. These medications have strong anticholinergic effects and directly affect dopamine in the brain. A comprehensive study published in the BMJ analyzed health records of 40,770 patients diagnosed with dementia. The researchers found that seniors who were prescribed antipsychotic medications had a 60% increased risk of accelerated cognitive decline compared to those who weren't given these drugs. Even more alarming, a study from Finland followed 70,718 people newly diagnosed with Alzheimer's disease. Those who were prescribed antipsychotics had significantly higher mortality rates, with deaths occurring an average of 1.5 years earlier than those not on these medications. The cognitive impact is measurable and rapid. A clinical trial published in The Lancet examined 165 Alzheimer's patients who were either given antipsychotics or a placebo. After 12 months, those taking antipsychotics showed cognitive decline that was 2.5 times faster than the placebo group. Memory tests revealed particularly severe impairment in areas of recall and recognition. The mechanism involves how these drugs affect multiple neurotransmitter systems simultaneously. They block not only acetylcholine but also dopamine and serotonin, all of which play crucial roles in cognition. Brain imaging studies have shown that seniors taking these medications experience accelerated brain atrophy, particularly in the frontal lobes. And now the number one medication you need to know about: number 1, anticholinergic antidepressants combined with other anticholinergics. The most dangerous situation isn't just one medication, but the combination of multiple anticholinergic drugs that seniors often take together without realizing the cumulative effect. This happens incredibly frequently because different specialists prescribe different medications without coordinating care. A senior might be taking an antidepressant from their psychiatrist, a bladder medication from their neurologist, and an antihistamine for allergies, and suddenly they're getting a triple dose of anticholinergic effects on their brain. A groundbreaking study published in JAMAL Medicine followed 3,034 seniors for over 7 years and tracked every single medication they took. The researchers calculated something called the anticholinergic cognitive burden score for each participant. What they found was shocking. Seniors with a total anticholinergic burden score of 3 or higher, which you could get from just 2 or 3 medications, had a 54% increased risk of dementia. But here's what makes this the number one issue. The study found that the damage appeared to be permanent. Even after seniors stopped taking these medications, their increased dementia risk remained. The researchers compared brain scans from before and after medication use and found that the brain volume loss didn't reverse when people stopped the drugs. Another study from the University of East Anglia examined 58 seniors who had been taking anticholinergic medications for at least 3 months. After stopping the medications, the researchers continued testing cognitive function for 6 months. While some improvement was seen in attention and processing speed, memory deficits persisted. The scary reality is that over 20% of seniors are taking multiple anticholinergic medications simultaneously. According to data from the National Health and Nutrition Examination Survey, most of them have no idea that their medications are working together to damage their cognitive function. A study from the University of Michigan found that among seniors taking 5 or more medications, which is common, 53% were taking at least one drug with strong anticholinergic effects, and 18% were taking 2 or more. Your medication cabinet might need a serious review. The research we've covered today isn't fringe science or preliminary findings. These are large-scale, peer-reviewed studies published in the most respected medical journals in the world. The connection between these medications and dementia is real. It's measurable, and it's affecting millions of seniors right now. But here's the important part. You should never stop taking prescribed medications without talking to your doctor first. Many of these drugs treat serious conditions, and stopping them abruptly can be dangerous. Instead, schedule an appointment with your physician and have an honest conversation about your medications. Ask if there are alternatives with fewer cognitive side effects. Request a medication review where all your prescriptions are examined together to identify potential interactions and cumulative anticholinergic burden. Sometimes switching to a different drug in the same category can make a huge difference for your brain health. Your mind is precious, and protecting it should be a priority in every healthcare decision you make. If you found this information valuable, please subscribe to our channel for more evidence-based health information that could protect you and your loved ones. Share with us your experiences and opinions in the comments below. We love to hear them.